Your heart health, diet, and lifestyle are all connected, but what do they mean when they say we can use food as medicine? We've got an expert in the house to discuss cardiometabolic disease. The Health Source podcast starts right now.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick Lord.
Welcome inside the Health Source studios on the campus of Marshall University. This is another episode of the Marshall Health Network's Health Source podcast. I'm Rick Lord, and today we are going to be discussing your heart health and specifically how it is all connected with your lifestyle choices and your diet. Everything works together, and to talk about what is called cardiometabolic disease and how it can affect your path to wellness is an expert, Dr. Andrew Vaughan from the Marshall Health Network. Doctor, thank you so much for joining us today.
Great to be with you, Rick.
First of all, we give everyone a chance to kind of explain this when they come on this show. Just talk a little bit about your background, what got you interested in cardiology and specifically cardiometabolic disease, and maybe define that term for people who might not be aware of exactly what it means.
Well, I grew up in West Virginia, went to school in West Virginia, and including medical school, and residency, and then fellowship training in cardiology in Pittsburgh.
Okay.
Came back to West Virginia, to Charleston, and practiced there for 25 years.
Wow.
Interventional cardiology, a lot of procedural-based things. Left that and went to the VA to join some of my friends that I knew from a long time ago, and was there for 10 years. And now I've been back on the Marshall campus now for 8, full-time faculty.
They treating you well?
Pretty well, yeah, pretty well. A lot of good folks here.
Yeah.
This whole road to understanding nutrition, risk factors, diet, and diseases of the heart really began well before 2015. And I'm working in the cath lab. I'm seeing coronary angiograms, all this, really bad disease in patients, and we're treating them with various devices, stents, maybe bypass, things like that. But that's not really, it's treating folks. They're better, they're healthier, they're less symptomatic, even maybe living longer with some of these procedures. But it hasn't stopped the root process. It doesn't
get to the core of the issue.
It didn't stop the process that started decades earlier. So that really got me interested in nutrition and seeing how that might play a role in maybe helping reduce the burden of disease in these patients. And in fact, maybe even moving a step back and maybe becoming a preventative intervention to preventing the disease in the first place. Not only restoring health, but also preventing disease. And so that's where it really started. There's been a long road towards a somewhat circuitous road to get where we are today, because this whole, you mentioned food as, or some people say food is medicine, really probably goes back to Hippocrates, who is famously quoted as saying, "Let food be thy medicine, medicine be thy food." Some people say he didn't say that, but in any event.
Well, we're getting real philosophical.
Yeah, right,
nice.
Exactly. But that was understood centuries ago. Right. And a lot of medicines have come from the plant world over time. Now we have lots of more sophisticated things now but in the early days, things were treated with plants. And that's still fundamental in Chinese medicine, as a matter of fact. But in going to treating disease, there's been a grassroots process in this country now for probably the last 15 years, where the intersection of nutrition and medicine at a level of culinary techniques has become really a curriculum in the medical schools.
Right.
And I'm happy to say that now in Marshall, we've had this program for 4 years. We've put over 130 medical students through the program in conjunction with, and it wouldn't happen without, the input of the Marshall Department of Nutrition and Dietetics. Really have to thank Dr. Kelly Williams and Dr. Amy Gannon for their support in doing this and in collaborating and working with me to bring this program to our med students now.
And I think a lot of people understand that food is your fuel. They get that concept. There's just been so many mixed messages over the years. I think it's kind of cluttered people, their minds with what works, what doesn't work, all these different diets, fad diets. Do I need to avoid fat? Do I need to avoid carbs, sugar? It can be overwhelming for a lot of people because they're getting one message here, another message there. Is there just a basic guideline for people to follow that I mean, it's never going to work for everybody because health is so personal and so complex and nuanced. What works for you might not work for me. But is there one specific guideline that you think overwhelmingly for the broader view works?
Well, I guess you have to say, well, what's the best diet? Well, the best diet's the one you'll follow.
Sure.
First of all. And I think also in terms of a diet, I mean, after all, diet's a 4-letter word. And in respect to that, many people come to that word as diet, and it's, what is it considered? Restriction, denial, calorie
There's a negative
counting.
connotation.
A huge negative connotation to that. And so we begin to sort of evolve to the idea that maybe a pattern of eating is better, because a pattern that you can incorporate into your own lifestyle is something that will serve you for a lifetime.
Right.
Probably the best one to answer that question is a Mediterranean style diet. It really does work. It's not a calorie counting diet. It's about counting the different kinds of foods that you eat through the day.
Right.
That's what it's about.
And mostly plant-based, and what you would think of when you think of Mediterranean olives and things like that. But for those that might not be too familiar with it, just break that down specifically what the Mediterranean diet consists of and what you're trying to avoid.
Well, there are 9 points that in the Mediterranean diet score, and those include the 9 various things that are fundamental to that diet. So fundamental thing first is vegetables. Mm-hmm. Green leafy vegetables, root vegetables, cruciferous, all the vegetables. Second, after that, legumes, beans, because huge source of protein, minerals, fiber, things of that sort.
And I don't mean to interrupt you,
No,
but
please.
that's important because when people think protein, the first thing that comes to their mind is meat. Right?
Absolutely.
Beef, protein.
Right.
Mm.
Right.
But you can find protein in other sources.
Absolutely. Plant sources.
Sure.
As a matter of fact. And then going right down the list, so you go from vegetables to legumes, then you go to fruits, and then nuts and seeds. And, Americans don't tend to eat enough nuts, but nuts are another source of fiber and minerals, omega-3 fatty acids, things of that sort. The problem is that nuts are really calorie dense. You got to be careful.
Yeah, and not all nuts are created equal. There's a difference between almonds and cashews, for instance.
Absolutely, right. Best to probably eat, maybe lightly roasted, unsalted, or lightly salted. That's certainly better than a bag of chips as far as the nutrition goes. And, dairy is a minor component to Mediterranean. As I mentioned, nuts and seeds. Meat, in terms of meat, land-based meat, not fish. The restriction is, or I'd say the advice is, really not more than a 4-ounce serving, which is really the size of a deck of cards of lean protein. Right. As far as fish goes, similarly, 4 ounces a couple times a week. It doesn't have to be every day. Better are the deep water fishes, that are high in omega-3 fatty acids, like salmon or tuna, things of that sort. And then finally, I mentioned dairy, and the dairy in a Mediterranean diet is really what would be considered fermented or cultured, so that would be like yogurt or cheeses, things of that sort, but it's a limited amount. And then actually on the Mediterranean diet score is alcohol. That's a huge hot button point across nutrition and socially as well, but it is the recommendations do say 1 drink for women, 2 drink for men, as much as daily, but that's with food. That is probably an important difference about going to the bar and having a few drinks as opposed to having the wine with dinner.
Well, a lot of people have just basic cursory knowledge. I mean, it makes sense. Okay, if I'm eating well, I'm going to be healthier. But how are all these things connected? Because you talked about going back and looking at the root causes and figuring it out and how it's all synergetic. So talk a little bit about how your lifestyle, your metabolism, your heart health, all of that connects to create a profile for your body, really.
So that you mentioned earlier cardiometabolic diseases. These are groups of diseases that they not only share a common pathway, but they share common negative effects on health. And that can include things like, obesity, which could be diet-related or maybe other medical condition-related. It can be diabetes. It can be other metabolic diseases, which is encompassed in a thing called a metabolic syndrome, hypertension, blood lipids being abnormal, and even included now in that is chronic kidney disease. All of these things can feed back into promoting worsening cardiovascular disease of all sorts, including coronary disease, heart failure. And so we've really come to recognize it really in the last few years that they really all have to be attacked. And so how do we attack this? Well, speaking with respect to the Mediterranean diet, it has been shown in many studies actually that following Mediterranean diet reduces the risk of diabetes. It helps reduce weight, even though it's not a calorie counting diet, because you're avoiding the bad things. What are the bad things? The bad saturated fats, very high calorie. The simple carbohydrates, sweets, sugars, they're way down on the list of the Mediterranean diet. Not that you can't have them, but in really limited amounts. And then finally, the other aspects of the lifestyle, which also help in weight management, exercise, even meditation, things of that sort can really help improve someone's lifestyle. And I tell you, it really does work if patients incorporate that into their daily thing. But it takes time, it takes counseling, and it takes setting the patient up to make some small victories that feed back to say, I'll keep doing this because I got some benefit from it. And knowing what their why is for doing that helps craft the plan for them. I want to see my grandchildren graduate. That
Sure,
kind of
yeah,
stuff.
absolutely.
So understanding what their motivation is does help to, counsel them into, adopting those principles for a heart healthy life.
You said a couple of things that really stood out to me there, so we'll go one by one here because there's a lot to unpack in that. You talked about, how something like meditation can help because that helps relieve stress, which can be a big part of this bucket, which can be of this whole relating stress and lack of sleep and nutrition and heart health.
Right.
So, I mean, those are some of the things that people might not even consider when you're like, okay, what can I do to start making my life better? Something as simple as just trying to relieve your stress can go a long way.
Well, that's true. And even not just, and I said meditation kind of is a big,
Broad,
task, but I think in terms of nutrition, it's mindfulness, being aware of what you're eating and not eating mindlessly, which is sitting there watching in front of the TV and downing a big
the whole bag of chips are gone.
They're gone, and they're gone, and there's a couple thousand calories easily, and so being and enjoying the process of eating and eating, with others, it's important. That social aspect is a big aspect of the Mediterranean diet, is eating with others, family members, community members. That sort of thing.
And another thing you talked about is time because it is a commitment. It can be overwhelming if you look at it in a big picture sort of way. So what are some things that people can do right now to start instead of saying, okay, well, I have to completely flip my diet on its head and just strip it down and start all over? That can be a lot. Is there anything simple that someone can do right now to get on that journey?
Well, I mean, the fascinating thing about the Mediterranean diet is that if an individual can change their point score a couple of points consistently.
Well, explain that.
So each of these things.
People might be going, point score, well, all of a sudden we're playing games. What's going on here?
Exactly. So all these elements of the different food categories carry a certain point based on the serving size. And so, for example, in the serving, I mentioned like a piece of lean meat, it would be a serving size. And so if you can increase, by in those different groups, a serving size or two a day, then that raises the Mediterranean diet score. Well, going from a 5 to a 7, let's say you're already kind of interested, you got a 5 score, and you take it to a 7.
What's a really good score? 10? Is that
well, the perfect score is 9.
Okay.
But being in the upper tertile, 7, 8, 9.
Right.
And consistently living there, that confers, based on lots of data, a 25% reduction of dying from various diseases. We have some drugs that'll do that, but not a lot.
Yeah, well, that's a strong sample size and a strong correlation for sure.
Right, it is. And so by doing that 2-point conversion up, then it similarly results in a reduced risk of heart disease and cancer death and that sort of thing as well. So there is science behind this. There was a huge study done in Greece many years ago that 22,000 individuals, and they conferred in 4 years. They were able to show this kind of data. And another big study that was done in France, looking at patients the Greeks didn't have disease. The study done in France, these were patients who already had a heart attack.
Okay.
They compared what they called a prudent diet, which was kind of a Western diet, to a Mediterranean pattern diet. And in the course of 4 years, there was depending on what output or what outcome you looked at, like current chest pain or a heart attack or dying of a heart attack, anywhere from a 50 to 70% reduction in the odds of having that happen.
So that's with people that already had a history.
Already had disease.
So that's an important point here, is that this is showing reversing effects.
Yes.
No matter what your health was like previously, if you start on the path right now, it can actually help reverse heart disease. Right. That's fascinating.
Yeah, it is, and it works, and it's been, and even in large, there's a term called a meta-analysis, where multiple studies are combined, and even that's borne out in meta-analysis of countless numbers of trials. But the other thing you said, how do you do it? And you said just what you said. It's not a light switch. You don't go from good to bad, bad to good. So there have to be these little events that happen that allow the individual to get really positive feedback. So, and then say, okay, do you like vegetables? And the answer is like, no, I don't like vegetables. So what do you like? Carrots? Do you like broccoli? There's going to be something they like. And you say, well, why don't you think about doing this, adding some broccoli? How do you do it? Well, you can roast it. That takes no time in the oven, and it's really delicious, and it's no added, a little olive oil, and you're good to go.
Kind of like what I tell my little boys, trying to get them to eat vegetables, right? Just start with one. And it's almost like you're building a house, right?
Yeah, right.
You do one brick at a time, and then before you know it, you hope that they believe you and they start understanding, and that they find things on their own that they might like to add to that.
Right.
And that's what it is all about, really, is consistency. And I'm sure that you have found that once people get on board with this, it becomes easier over time.
It does, because then they'll begin to expand out and think about other things. And re-emphasizing and that foundation of how they got there, it really does help. And it's not a all or none thing.
Sure. And as we mentioned, everyone has their own health profile, and you can't sit there and go, okay, well, after 23 days and 5 hours, that's when you're going to start feeling better. Right. So is there a basic kind of window when that you tell people, okay, trust me, stay on this for a little bit, and after X amount of days, you should start feeling a little bit, or is it just one of those things where you just have to know your own body and judge it by that?
I think it varies, because it varies about in terms of the number of changes.
And what else you're doing. There are a lot of other factors.
And what other factors, that are happening, exercise and things like that. But in terms of weight loss, I tell my students and when I see patients in the clinic, I can get, in 30 seconds, I can find out where the problems are in the diet by asking 3 questions.
Oh, okay.
Do you eat at home?
Right.
If you eat out, how many times a week do you eat out, and where? What do you drink, and what do you snack on? Okay. If I get the answers to those, I know what the dietitian needs to really concentrate on.
I would assume, and let me take my shot at this, that if you're eating at home, that you're more likely to be using whole foods and knowing what's going into your diet and what you're eating.
That's right.
Whereas
Absolutely.
if you're eating out, you never know what you see it. Seafood, eat food, right?
Right. That's right.
And obviously with drinking, you're probably looking at things like, are they healthy drinks, right?
Yeah, the sugar-sweetened beverages.
Right.
That's the big one.
Okay.
That's the big one, really, because those are the worthless calories.
Okay.
And I can tell you an anecdote. So a guy came in and he said, he's really had a weight problem. I said, what do you drink? He says, Pepsi. I said, regular Pepsi. Yeah. How many? 4. A day? Yeah. What, 20 ounce? No, 2 liter. That's 8,000. That's 8,000 calories. Yeah. And we got down to 1, and he lost about 60 pounds in 3 months.
Is sugar one of the main components? If you can just reduce sugar.
Yes, and the dietary guidelines say this. And in your own defense, when you go to the store, the grocery store, your own defense is the food label. It tells you what is in there. And now, in the last several years, they've added the added sugar line, which is just the added sugar, which you don't really need to have. And so you can add up those points and figure out how you can get rid of those, because that's, in looking at the diet label, that's where you can at least get an idea.
And it's important to check that, because you can't just go by what they're advertising to you. They know what works.
No,
so you'll see words like all natural and think, oh, that's good for me, but
that's right.
Not necessarily.
Right.
You have to actually do a deep dive and look at the label and see exactly what's in there.
See, the classic is salad dressings. They say no cholesterol.
Right.
But they make it with a really bad oil, and they put a lot of sodium in it to make it taste like something.
Right.
So these kind of things.
That's how they get you.
That's exactly right. You have to be really defensive shopper. You really do.
So briefly, just go over maybe, because this can be overwhelming for a lot of people, and a lot of people struggle with finding something that works for them. And a lot of times you can learn lessons by maybe what other people are doing wrong or what other people got wrong. So what are maybe some common myths and misconceptions about metabolism and diet and nutrition and how it all works toward your heart health?
Well, that one diet's better than another. I mean, no matter what diet, people will lose weight on any diet because calories are restricted and calories are restricted. So, people say, well, I can only lose weight on a paleo diet, or I can only lose weight on Atkins, and to remember that the composition of the macronutrients, protein, fat, and sugar, carbohydrate, is different in all of those. And those diets have been compared head to head, and people will lose maybe a little bit more weight with one diet, a little bit less weight with another diet. Maybe their lipids will be a little bit better with one or the other, but they still lose weight. But in the end, there's always attrition. Yeah. And actually, a keto diet is a really terrible diet to try and follow. I mean, a real keto diet is a really difficult diet to follow because you're turning your metabolism into ketosis, where you're making acids in your body, and that's suppressing the appetite. Now, there have been some things that might actually work to help treat, but which is beyond kind of the scope of this, but it only takes like one Oreo to completely turn that off.
Right.
and you're back on the same
then
track.
You're eating 20 Oreos.
Yeah, right. And make up for the ones you didn't.
Yeah. Well, there's a lot of changing in science constantly, which is good about science because you should always be learning and evolving and adapting. Right. I think everyone agrees that processed foods are probably something to avoid.
Oh, absolutely.
So, but you hear things like RFK Jr. famously saying that the pyramid should be inverse, that we should be completely flipping around. People talking about carnivore diets and things like that. Is it safe to say that as long as you're eating whole foods in moderation, that you're at least on the right track?
I think that's absolutely right. There's a famous journalist, Michael Pollan, I don't know if you know that name or not. He's written about food for decades, the Omnivore's Dilemma. There's some other books.
Sure, I've heard of it. It's not like I can get on the phone and say, hey, Mike, what's up? We're not tight, but I have heard the name.
But he's written a lot, and he has a lot of little phrases that he uses. But one that I think is very helpful, it says, eat food, mostly plants, and not too much. And I think that's, if you get down to a truism, and a dear friend of mine who's a cardiologist used to tell his patients, just eat what's grown in the ground. And I think that's what it's about. In West Virginia, I think everybody understands that.
Well, and expanding on that, we'll get you out of here on this. If you did have like one concise piece of advice for everyone to say, okay, this is what you need to focus on for the next 10 years to from point A to point B, just do this. What would be your simplest advice for everybody?
I think eat plants. I mean, I think that's the simplest thing. Stay away from ultra-processed or highly processed foods. And actually, speaking of the guidelines, I mean, the new guidelines were just released 2 months ago, and they were the first guidelines for Americans to actually say, do not eat processed foods. First time ever. And that's a very positive thing.
Well, we thank you so much for your time, and we look forward to seeing how your journey goes as well. We'll keep in touch with you and see how it's going out there. Real quick, tell people the easiest way to get a hold of you if they're like, oh, I like that doctor, I want him.
Marshall Cardiology. Actually, I see patients at Taze Valley at the Marshall Clinic there, and I also see folks to manage their lipids and other preventative things at the Bird Center over across town.
All right, Dr. Andrew Vaughan, thanks so much for joining us, and thank you. Remember to like and subscribe so we can keep doing this. We can't do this without your support, and we thank you for your time today. For the doctor, I'm Rick Lord. Until next time on the Marshall Health Network's Health Source Podcast, take care.
That was the Health Source Podcast, presented by the Marshall Health Network.